just replace those teeth with dental implants. Now, if a patient is missing 3 teeth, often the dentist needs to use a couple teeth in the adjacent areas. So 3 plus 2 on one side plus 2 on the other side is like a 7-tooth solution to 3-tooth problem. A dental implant can be a 3-tooth solution, a 3-tooth problem, or 2-tooth solution to 3-tooth problem, because in the 3 space, we can either give 3 implants or 2 implants and make a bridge from implant to implant. I probably should also say that often patients say they're missing like 2 or 3 teeth. They say, can't you just place one implant at one end and then use a natural tooth to the other end to make a bridge? This is not recommended, for different reasons, because implants are solid in the jawbone and teeth always have a little bit of a mobility. There's some shock absorbing effect around the teeth, and so it's really not a stable situation. And then, as I said, in order to use a tooth, the dentist actually has to remove the enamel around the tooth to downsize the tooth in order to build up to its original shape, in order to make that into a support for the bridge. So that is not recommended.
Are there any contraindications to implants, doctor?
Well, yes, there are few contraindications, and ironically, it is not really whether the patient has bone or not, because as I mentioned before, if a patient doesn't have adequate bone, we can always make that. It's called augmentation. For example, the upper jaw, if a patient has lost their teeth, often the sinus kind of drops down because the teeth kind of support the sinus like a tent pole. And in the past, when a patient had lost their teeth in the upper jaw and sinus had dropped, they were saying there's not much more we can do the implant. So that was a contraindication. In the lower jaw, often patients have lost their teeth for a long time. The jawbone has dissolved to a point that the nerve in the lower jaw, which is a very important nerve, is very close to the surface. So dental implant is not indicated, or was not indicated. Of course, nowadays we can bypass that, make the bone for the patient, regenerate the bone. So these are not absolute contraindications. They are absolute if they are not. They are contraindications if the patient says, well, they don't want to build their bone. They want me to use the available bone. But if they're ready to listen and do what's needed to build them, that's fine. However, there are some absolute contraindications. It really starts from a patient who's not cooperative. That means if a patient has lost their teeth, there is a reason they did. And generally, it's lost because of gum disease. The gum disease, of course, besides the fact has some genetic background, it also poor oral hygiene, lack of attention to proper dental care. And if the patient doesn't want to do that, then there's no reason for them not to get the disease around the dental implants, called peri-implantitis. And of course, if the patient, I call them to become a convert, that means they understood what it is and now they just don't want to go there, then that we can do it for them. But the other contraindications, which are very important, are systemic diseases like uncontrolled diabetes, patients who have cancer, and I don't recall, there are a couple other situations right now, but we definitely review their medical history, and then if you have any question, we actually write a letter to their physician and have them evaluate the patient and say whether they can have the dental from systemic disease. Another contraindication just came to my mind are really medications that are given for people who have osteoporosis. The longer they are on these medications, the worse the healing process of the bone becomes, and it's not a good idea to consider implant for those patients, especially patients that have had cancer and they are on IV medication, for the bone. That's an absolute contraindication. We cannot do that.
Thank you for all the informative